Okay, so this is our Solano County Community Health Assessment for Rio Vista. Rio Vista is known as the heart of the Delta. It's a small rural town in Northern California, and their official website boasts that they are a family-friendly community in which to live, work, and play. Their eastern border of Solano County, and their western border is the Sacramento River Delta. As you can see on my map, Highway 12 divides the downtown area of Rio Vista from east to west. You can also see that they do have a small municipal airport, and I have labeled Trilogy at Rio Vista. That is a large 55 plus retirement community. Their website says that they have a large golf course, clubhouses, fitness center, and offer recreational classes. A little bit more about Rio Vista. During our research, we found out that Rio Vista is the home of the largest endive farm in the United States. I didn't know what an endive was until we started researching this, but it's a vegetable. It's low calorie, low fat, low sodium, high in fiber. Overall, very good for you. And their website says that you can use it as an alternative for chips and crackers to dip. Harley will talk a little bit more about the significance of this farm in Rio Vista. So a couple areas of concern in Rio Vista that we have identified. They have the highest uninsured population and the highest unemployment population in Solano County. The USDA has deemed them a food desert, and that's defined as a community without readily available fresh, healthy, and affordable foods. They also have the lowest percentage per population with access to a park in their community. They also have a health provider shortage for primary care and mental health. And they have the #1 highest mortality rates for heart disease and all-cause cancers. So a little bit of background on the areas of concern that we identified in the HSA. Rio Vista is also home to the largest gas field in California. The Royal Energy and the California Resource Production Corporation are currently expanding their drilling sites, and that's of April of this year. And I found an article that from the University of Colorado that explains the increased cancer risk for populations living within 152 meters of an oil or gas facility. The cancer risk estimates about 8.3 per 10,000 for populations living within 152 meters of an oil or gas facility, and that far exceeds the United States' Environmental Protection Agency's 1 to 10,000 upper threshold for that. Also, their airport would also give off carbon monoxide toxins as well. So as far as the top health concern that we identified for Rio Vista, they are #1 in colorectal cancer. You can see 5.47. In Solano County, the median is 4.01. And throughout the entire state of California, 3.88. They are #2 in Solano County for prostate cancer, only beating, I think it was Vallejo, whose numbers was 25, and Rio Vista, you can see, is 24.93. Breast cancer, we're also #1 in breast cancer for Rio Vista, 30.0. And that's over double than the median for the state of California. Lung cancer, also #1 for Rio Vista, 8.02 for Rio Vista, Solano County 5.45, and the state of California is 4.54. As far as mortality, all-cause cancers, Rio Vista is #1. 31.62, which is more than double than the Healthy People 2020 initiative, and also for the state of California, 15.41. So Harley is next.
So I'm going to talk about the overview population of the Rio Vista. So its total population is 8,025. Living below the poverty line, federal poverty line is 10.9%. Median age is 56.9. Uninsured, as Lauren has mentioned, is 21.2, highest in Solano. Median income is 54,223. The minority is composed of 31.3%. So the racial overview of the Rio Vista is mostly white, 81.6%. Hispanic Latino is 12.4%. African American is 5.1%. Asian is 4.9%. And Native American is 0.7%. And Pacific Islander is 0.2%. So based on the article of Israel in 2016, comparison between the European Union versus Rio Vista, California, the European Union guarantees universal health care for a basic service package by either universal, citizenship-based, or insurance-based healthcare arrangement. Though both of them, European Union and Rio Vista or America, they both identified the same socioeconomic socioeconomic status as the SDOH, determinants, which is education, low income, and also language barrier and geographical accessibility. The difference between this European Union and the Rio Vista, the European Union focus more on social policies that helps the individual who fall into certain categories to deter from accessing healthcare. They have social policy programs like the housing allowance, family allowance, and social allowance. They have identified the importance of social protection policies to complement public health policies in improving population health. In Rio Vista, California, we don't have a universal. We have the Affordable Care Act, the Medicaid, Medi-Cal. However, they're still highest uninsured in Solano County. Both the European Union and Rio Vista had identified the same HSHDOH. So European Union is more on social policies in place which focuses on the basic needs of the individual, whereas America, or Rio Vista, where America is, as a developed country, spend less on social services like food programs, housing support, and other support for high-risk groups. I'm going to talk about Rio Vista, the Bar-He model, or the Bar-HII model. So the upstream, the social inequities, we have the low socioeconomic status, the ageism. Institutional power, they have the large indirect crop, as Lauren had mentioned, but they ship it outside the US. And there are the Royal Energy Incorporated, increases the drilling sites. This is the natural gas. And their living condition, lack of quality grocery stores. So it's, as Lauren had mentioned, the USDA had labeled it as food desert. High property crime rates, high rate unemployment, Rio Vista gas field and airport, which eliminates toxins, limited modes of transportation, primary care and mental health provider shortage. So the high population burden score. So the risk behaviors are poor nutrition. So that is why it is so interrelated with their number one in colorectal cancer, they're number one in breast cancer, they're number one in lung cancer, they're number two in prostate cancer, number one in heart diseases. The mortality is the number one in all cancer cause and number one also in heart diseases. So I'm gonna turn the table to Michelle.
All right. So what are we going to do about this problem? We all have identified that there's a high rate of cancer in Rio Vista, and there's definitely some socioeconomic issues that need to be addressed in this cancer or in this policy regarding cancer. So we've come up with this Prevent, Screen, and Treat, a free cancer initiative for the Rio Vista community. So a statement of our problem is, do you have health insurance? Chances are not in Rio Vista. Rio Vista, once again, has the highest population of uninsured residents in Solano County, and also the highest mortality and rates and all-cause cancer rates. So what is our solution? What are we going to do about this? So we've come up with a community-based cancer initiative, and it's focused on education, screening, and connecting patients with treatments outside of the community for those who need further follow-up. We're going to hold a clinic on the first Thursday of every month from 4 to 6 p.m. And there's a senior center that's downtown on Main Street that's very convenient, and will have the availability for us to be able to hold these classes and do these screenings. We're going to staff this with professional nurses who are trained in cancer screening and knowledgeable about the local resources and where to get these people directed to help intervene. We're going to have education classes that are focused on prevention and early detection, such as smoking cessation, and why you actually need to be screening. So we're going to offer screening for breast cancer, cervical cancer, prostate cancer, lung cancer, and colorectal, all in a very comfortable and private setting. Screenings that require additional investigation, we're going to be referred out to our partner systems in John Muir and possibly even through the Solano County Family Health Services. And we'll talk a little bit more about that in just a minute. Participants are supported throughout this whole initial process. We can help with paperwork and filing and actually getting some of those benefits that they're more than likely entitled to, such as Medicaid and Medi-Cal, that will help cover some of these expenses. And support systems as far as helping with follow-up appointments and transportation. Did you know that the American Cancer Society has a program in place that's called Rides for Recovery, or now I forgot. But anyways, they'll actually help people get to their appointments and help with that. So who's going to pay for all of this? One of the biggest problems in healthcare is funding. So we've come up with some average testing costs as far as what this screening is going to cost. For males, it looks like it's going to be about $337. If you kind of needed everything, it could be a little bit less than that. And females, about $509 is what we're coming up with. And some of these things are not going to apply to everybody. So that's kind of our average for prices there. We have a mammogram test, a PSA testing for the males, colorectal screening, which is looking basically for the occult blood, which is where this is priced. But obviously those prices are going to go up significantly if that occult blood testing comes back positive and you need a colonoscopy. And then there's going to be some just questionnaire screening. So for the lung cancer that really doesn't have any costs in with that other than, going through the paperwork. But this one group here, these 55 to 80-year-olds, if they are heavy smokers or if they've quit in less than 15 years, the suggestion is that they have a yearly low-dose CT scan. So this money, so the California Endowment has actually been active in Solano County, and they've had 14 grants giving $1.3 million to 15 recipients in the county already. And they actually have a partnership program that they will match $3 for every $1 that's gifted. And my thought is, what about this Royal Energy company who's coming in here and doing all this drilling? They're a $58.8 billion company. Can we get $100,000 from these folks and match it with another $300,000 from the endowment? Or the Endive company, the California Endive Farm has an annual revenue of $8 million. So there should be there should be some money, and this should be tax deductible from these companies, and we can match that money. And then we'd also like to build a partnership with John Muir Health. So they have a program in place where they have already distributed $28 million to different organizations that demonstrate trust and relationships and serve the uninsured and underserved populations with the long-term goal of relationships and that last after the grant. So they're focusing on exactly who our population is. And some of these test costs in the previous screen should probably come down if we can build a great partnership with these guys. Funding is also available through a lot of grants and partnerships with these other organizations that are listed on there. And they offer anywhere from maybe $10,000 to $100,000 in 1 to 5 year financing. So I think the money's there for us to be able to make a difference in this community when we're ready to move forward with this. Thank you, guys.